Hi, everybody. In this video, the question that I am going to answer is, will state efforts to support the elderly and their caregivers work without federal support? And the reason that this topic comes up is because it's in response to all of you who watch my videos on YouTube about Medicaid and Medicare, and those of you who have expressed concerns about how on earth do we pay for this care that is ridiculously expensive? How do we do this? Who's going to help us? What is going on? So in this video, I'm going to share information about 4 areas, and I'm also going to ask questions because I want to see what you think and learn about your experiences. So I ask you to, 1, click below, like and share this video, share my YouTube channel, but also please comment on anything that you hear in this video and answer the questions that I pose. This serves a couple of purposes. Those of you who watch my videos know that I respond to almost every single comment that you make. The only reason I wouldn't respond is if I can't find them, if they're buried in a long stream of questions or something. But I respond to every question that you pose below. And also, the more questions that you ask, the more that YouTube will send these out to videos, send these videos out to other people who are looking for hope, help, and support on similar topics. So if you don't know me, I'm Pamela D. Wilson. My website is PamelaDWilson.com. I am a caregiving expert, advocate, and speaker. I have been in your shoes for more than 20 years. My website is PamelaDWilson.com. I have a podcast called The Caring Generation, and there are over 800 videos and growing here on my YouTube channel. Now, throughout this video, I'm going to mention a lot of information, programs, legislation. If you want to find the links to these so that you can look into these yourself and learn, down below in the comment section, there will be a link to a blog post on my website. And if you live in the states of Washington, California, or New York, and you don't know about pending legislation for a payroll tax to pay for long-term care insurance, you are going to want to stay and hear this information. And also, if you don't live in these states, you're going to want to know about this information because it will soon be coming to a state near you. So here's the 4 areas. One is the challenge of accessing programs and the daily experiences that you all struggle with, which I know you know, but I'm going to mention a couple of these. Then number 2 is how these programs designed by the federal government and state governments, when they are supposed to be designed to help you, sometimes do the opposite, or they make more work out of something than it should be. And so what happens is you all just give up. Then I'm going to talk specifically about the information I mentioned, Washington, California, New York, the legislation that is either already in place or is being considered so that you know about future potential for payroll deductions and access to long-term care insurance. And then the last thing I really want to talk about is how to get all of you engaged and involved in what's going on at your state level or a local level. And this is not a political request. It's about having your needs be heard, about having the people in Washington or in your state government listen to us, the caregivers and the aging adults who are having to struggle with healthcare systems and being unable to pay for prescriptions and healthcare and all this stuff that is just getting to be so unaffordable. Now you might say, I can't make a difference. Well, I can tell you, you can make a difference. And 2 of you can make a difference and 5 of you can make a difference. It's just that you have to get engaged. So I'm going to show easy ways for you to be able to do that. You don't even have to leave your house. You can attend a lot of virtual meetings that are going on out there that you may not know about. So here's the challenge. If you are a caregiver or an adult and you're trying to keep up with all this healthcare stuff, right? It's nearly impossible to keep up with because there's so much and you have this life to live. You have a job, you have a marriage, you have kids, you're going to school, maybe you have aging parents that you're taking care of or a spouse. A lot going on. So there's only so much that you can focus on every day, right? Everything else you got to just shut out because it's too much. So trying to understand the complexity of healthcare systems, navigate care, it's very difficult for the average person. Now, here's where the complications come in. Federal and state programs can be very narrow. And because they're narrow, A doesn't know what B is doing, B doesn't know what C is doing, C doesn't know what D is doing. And they all may be doing the same thing. So there is this lack of coordinated effort to meet the needs of aging adults, persons with disabilities, their caregivers. And what happens is people, legislators, they enact a law, and then that one wasn't right, so then they enact another law, and then they put another one out there. And they're all about the same thing. And we never get anything accomplished, or we don't get as much accomplished as we could. So things that affect older adults that I hear about in these videos and in people that I talk to. You know, transportation to appointments. Sometimes you find access to a social care service program and the paperwork is so difficult you can't get it filled out. Or maybe, honestly, you don't trust the people who are helping you with the paperwork. You don't trust the government, right? You don't trust the doctors who are trying to help you because you feel like they're not giving you the full story, or they want more information and you don't know why they want the information, or you give them the information and they don't do anything with it, right? And then the healthcare system has these other goals because they are regulated by the government and other agencies. So while you have all these obvious problems here, these healthcare systems over here are looking at their goals and return on investment and all these other crazy things. And you're just struggling to make a doctor appointment or to complete a form to qualify for services. And if English happens to be your second language, maybe you go to a doctor appointment and the doctor or the nurses are using all these terms and you have no idea what they're talking about because they like to use words with abbreviations. And so that makes you hesitant because you're like, well, if I don't understand what they're talking about, how can I trust them? And do I know if this is really going to work? So you don't get the care that you need, right? So question for you, comment below. If you face any of these struggles in trusting healthcare providers or getting services or learning about services, what would make it easier for you to do this? And if you could change something in the healthcare system with interactions with doctors or health insurance companies, what would you do? If you could wave this magic wand and just fix it, how would you do that? So let me talk about section number 2 or item number 2, which is the fact that programs that are usually funded at the federal level flow down to the state level, right? And many times they're not designed for, like I mentioned, agencies to work together. So A doesn't work with B, doesn't work with C, doesn't work with D, even though they're kind of doing some of the same things. And so the problem is they focus on this narrow cause, narrow population, or whatever. And the programs, because they're federally and state government designed, may look at things like their return on investment, or they need a lot of data analysis, or they're trying to manage risk or spend less money on healthcare. Well, as consumers, we don't really care about that, right? We just care about getting the care that we need. So somehow we have to combine all of these corporate, federal, state, corporation needs and goals with what the caregivers want. And so caregivers can be much more active in expressing needs and participating in these programs to help the other side meet our needs and gain our participation. Because one thing they really need to produce all these outcomes and this data is they need consumers and patients and older adults and caregivers to actually participate. What does that mean? That means going to a doctor appointment. That means filling a prescription and actually taking the medication, because they have to prove that their recommendations help you, that they have positive results, right? But if you don't trust them, how on earth is that going to happen? Or if you can't afford to go to a doctor appointment, how on earth is that going to happen? So we have this huge gap on both sides, and somehow we have to come together. So many of these state agencies could come together if they would recognize that a lot of the things they work on, they really have similar goals. The problem is they have different funding sources. And those funding sources or the legislation that creates those programs may have guardrails or fences that says, oh, you can do this, but you can't cross over to the other side. That's where y'all can get involved by becoming more involved in the things that are going on locally in your state, because there's a lot of fragmentation at federal and state levels that results in all of this overspending. And many of you who watch these videos, I hear your complaints. I empathize with your complaints. You're saying, why are we sending all of this money out of the country to all these foreign countries? And we have people here, my parents, older adults, homeless people, people in prisons. We have a lot of people here who need help, that they're not getting the help. So should Congress be allowed to just vote all of this in without asking us, without asking the consumers? How does all this legislation get enacted? And we wake up one day and we find out that all of a sudden we have a payroll tax on our paycheck. And it's taken out money for a state long-term care insurance program that we didn't know about. Nobody asked us. It didn't come up for a vote. How on earth does this stuff happen? That's what you have to learn. That's what you have to become involved with so that we can change the system. So, question, should guardrails or guidelines or whatever you want to call them be placed that require analysis of programs to see if there's already something in place by multiple agencies and to make a decision whether that gets approved or not, or whether Program B, who wants this, has to go approach Program A and say, hey, how do we work together? I've got some funding, you've got some funding. How can we work this out? So to give you a concrete example of this duplication, I'm going to share information about two programs that do very similar things, but yet they come from two totally different agencies. Now, the first is more of what I would call a community or consumer-based organization. And the other organization is more, I would say, clinically or medically focused, which may be the reason that these two organizations don't even talk to each other, right? So there was this act that was passed in 2017. It's called RAISE, R-A-I-S-E, which in this case means Recognize, Assist, Include, Support, and Engage Family Caregivers Act. Now, if you Google RAISE, this is probably not going to come up. What is going to come up are a couple of other acts under the same name. One about wage equality or equity. Another one, which is a proposal to reframe alternatives to incarceration sentencing. Those are not what you're looking for. If you want to find specific information on the RAISE Act, down below in the comment section, click on the link to the article on my website. It has links to all this information. You won't have to do a bunch of searching. It's all there. So this program, the RAISE Act, is a program of the Department of Community Living, okay? And they're called the ACL. Now the ACL, through this RAISE Act, was given a project. It's a great project, right? It's a project to identify federal programs that support caregivers, which could identify programs that duplicate efforts or spend inefficient amounts of money on programs. Now, the problem is the RAISE Act just said, well, identify the programs. If you want to see a list of these programs, again, click the link below, go to my website, you'll see every program that's listed. And actually, some of these programs might be helpful for you. But here's the thing. The Act said, well, identify the programs and share the information. The Act didn't say, after you identify the programs and the duplication and the duplicate spending, you must do something to end program duplication and inefficient effort and inefficient spending. Because by golly, if we do this, maybe we'd have money to support other things that there is no funding for. Now, this seems like a pretty practical idea, right? But we don't see it happening. So how many of you feel that this is something that should be done? And if we translate this to like a real life example for all of us, right? How many of us need, 20 pair of socks in different colors? Or can we get by with 7? How many of us, regardless of whether we have the money or not, right, would go out tomorrow and buy 20 jars of peanut butter or 10 cartons of eggs or whatever? And we can't really use it. It's just more and more and more of something, right? Sometimes it can seem that federal government programs don't consider like duplication. If we as consumers can't, it doesn't make sense to do these things, why do we allow the government to do it? Why is the government allowed to spend and spend and spend and go over their budgets, and we have this huge deficit where we as consumers, if there's no money in our bank account, nobody's like giving us checks to pay our bills, right? So we as consumers have to stay within our budgets. Why doesn't the government have to stay within its budget? Why can it keep spending and spending and spending and spending when we can't? Healthcare spending is out of control, and consumers are getting no relief whatsoever from this, which again is why I'm sharing information about these programs so that you can become more educated and learn and start advocating in your local communities. So this example that I'm going to share, I know that was a long explanation, relates to Alzheimer's and dementia care. Now, I don't debate the need for Alzheimer's and dementia care. Alzheimer's caregivers have a difficult job. It's for a long time. People with Alzheimer's have a lot of needs. I agree that we need programs, but I don't agree that we need 10 agencies doing the same thing a little differently and not combining their efforts or the results or spending less money on something to get the same outcome, right? How do you feel about this? So this year, 2023, there was a grant opportunity by the Community Living federal program, right? It's called the Alzheimer's Disease Initiative, and it was for home and community-based services for states to expand dementia services. Now, at the same time, CMS, which is the Center for Medicare and Medicaid, they're more on the clinical side, right? They announced this guide model, which is guiding the improved dementia experience. 24/7 hotline, caregiver support and training, all of that. The idea is to keep older adults in their homes longer so they don't have to go to the hospital or move to a care community. What does home and community-based services do? It's intended to do the exact same thing. Now, if I had to guess, I would suspect that anybody getting this grant money from the Community Living group has no idea that CMS has this guide program out there. And they're not sharing information. They're not talking about it. They're not, helping consumers say, hey, we've got this program. And by the way, we have this program. They can help you even more. No, instead, they're going down 2 paths. So questions for you. Comment below. As government spending for healthcare continues to just escalate, should there be mandatory requirements that avoid all of this duplication of effort? Are we just funding department after department after department because they've always gotten the money? And of course, they use the money so that they get more money next year because they need a purpose. They need a reason to exist. Should this be allowed if there's no benefit to the patients or consumers or people in society? Can a strategy be developed to use this money more effectively? If it's not needed here, can it be shifted to another program? Or by golly, if we don't need it because we already have more than enough, why not stop the spending and start reducing our national debt? Here's even the bigger question, right? Why would this government agency, the ACL, who was tasked with ensuring that there's no duplicate programs and no duplicate spending, develop and put a duplicate program out there? Some of this honestly doesn't make logical sense. And I'm not saying that I know the backstory because I do not. I don't work for the federal government. I don't know what goes on in these agencies. But as a consumer, as a business person, as an entrepreneur, I just can't imagine the duplication of effort and the unnecessary spending that is permitted to keep occurring. So if the government can fund an agency to identify duplicate spending, why can't we fund another agency to just stop it? Put your thoughts below. So now let's get to the even more interesting topic, states who are investigating their own long-term care insurance programs. Washington, California, New York, there's a few others, but these I'm going to talk about because I can point you to specific legislation. Again, link below in the description will take you to all of this information. So if you're an older adult or a caregiver and you're saying, oh my God, how am I going to pay for all this care? My parent needs to go in a nursing home, or I need caregivers to come into the home. We can't pay for medications. We have all these issues, right? You have to talk about these problems and these issues, right? But yet Congress talks about them. They may not do anything about them. So out of this community living government program came some recommendations. Now, they're only recommendations, right? They're not saying you must do this. You have to do this. Again, it's like we spend all this money on recommendations and we don't spend any time making sure that they get carried out. So here's what states are doing to actually make something happen. Recommendation 4.4, again, if you want to find it, link below, go to my website. The recommendation is to improve the affordability of long-term care services and supports and reduce the out-of-pocket costs for families and caregivers and older adults through public and private payers. Now, you may hear that and say, hey, reduce out-of-pocket costs. Man, that sounds like a fantastic idea. But that recommendation may not really be easy to understand if you don't know what public and private payers mean. And most people don't. I didn't before I worked in healthcare, right? I'm like, what the heck does this mean? So public and private payers are insurance companies and federal and state governments. So programs like Medicare and Medicaid and Medicare Advantage programs and other private insurance programs. So you hear this and you hear the word, reduce out-of-pocket incomes. Yeah, I'm there. I'm in for that. I support it, right? But the problem is you don't really know how that's going to happen or if it's going to happen, right? And for all of us, how many of us want to see our health insurance premiums go up or pay more for prescriptions or medication or pay more to see the doctor when we already can't afford to do it anyway, right? High care costs, especially for people over 65 who are on Medicare, prevent them from going to the doctor because they can't afford the copay, prevent them from picking up a prescription because they can't afford the copay. So what happens is they get sicker and sicker and sicker and need more care and more care and more care. And who shows up but you, the family caregivers? So state governments have recognized, at least some, that family caregivers and older adults can't continue to pay these costs and that these costs cannot continue to be funded by the government because there's not enough money to go around. We're already facing a huge deficit, right? You can't keep spending money that does not exist. So what's happening is these states have done investigation, have done studies, are doing investigations, are doing studies to create a payroll tax for all of us who work to pay for long-term care insurance in a state. So let's talk about the state of Washington. They have what is called the Washington Cares Fund. And this started this year. So beginning in July of this year, everybody who works in the state of Washington, except for some exempt individuals, which I'll share in a minute, are contributing 58 cents per every $100 into this fund. And the fund has a ramp up or a time period that it has to start working, right? So this is 2023. Beginning in 2026, people will begin to take money out of this fund to pay for caregivers to come into the home, to pay for maybe a care community, to pay for assistance for older adults who need qualifications. So, you have to qualify for this, right? This benefit for people who work and contribute can eventually amount to $36,500, which can be a huge help if you don't have any money saved for retirement. Now, there are people who are exempt, like federal employees, because they have their own long-term care insurance program. Self-employed individuals can opt out. And particularly in the state of Washington, you have to continue to live in the state of Washington to get this benefit. So let's say that you live in the state of Washington and you've been there for 20 years and all of a sudden you decide you want to move to, I don't know, Kansas or Illinois. You lose that benefit. How much sense does that make, right? In a perfect world, every state in the United States would have this benefit. And it wouldn't matter if you lived in Washington and you moved to Kansas, or you lived in Texas and you moved to New York, or vice versa. Your benefit would go with you wherever it goes. Well, if you live in Washington, it doesn't, right? So these are kind of the unintended consequences of states wanting to try to do something really, really good, but the federal government not getting involved to say, hey, states, if you want to do this, let's do it right. Let's make it so that all the states participate. So this seems contrary, right? Because that administration or association community living who did all those studies that said, hey, we want to avoid duplicate programs. We want to combine efforts. We have all these recommendations for states. Why isn't the federal government participating? I don't have an answer. That's questions that we should all be asking. So let's talk about California, big state, a lot of people, right? California has something called the Long-Term Care Insurance Task Force that is doing a very thorough investigation on options to create wage deductions, payroll taxes, for state long-term care insurance. Now, the cool thing about California is they're pretty progressive and they're working with another California department. Imagine that, Department of Aging Services, who is working on what's called the California Master Plan for Aging. And California is one of the states that seems to always be on the forefront of this. Other states are doing this, but California is probably the furthest along. Now, the California Master Plan for Aging is in the works, and there's a timeline. They've got all these projects that they're doing. It's going to be in place by 2030. This long-term care insurance program is also going to be in place by 2030. So these agencies are working together, which is really cool. Now, here's the cool thing. If you want to learn more and if you want to understand what these groups are doing, California is one of the states that has enacted legislation to make access to these meetings free over the internet. All you have to do is go sign up and attend. And if you can't attend, most of these groups record the presentations and you can watch them later on the website. A lot of these groups ask for what is called public comment. That is comment from what they call stakeholders, right? So businesses in long-term care insurance or hospitals or health systems or doctors, insurance companies, all that. But it's also public comment from people like us so that we can get on there and say, you know what? We're not sure this makes sense. I was on a meeting the other day and somebody from a group said, I know you guys are investigating all this and you're spending a lot of money to investigate it, but is it really going to be worth it in the long run? Are we going to get what we want out of this program? That was a great question. And unless you and I and everybody else out there starts asking these questions and gets them on the record, legislators and people who create these bills and enact these bills don't have to pay attention to us. If we want our needs to be met, we have to start advocating. Now let's go way across the country to the other side, New York. New York is a little closer on this than California. They actually have pending legislation for something called the New York Trust Act. It's a Senate Bill S9082. Again, if you want the links, go below in the description section, click on the link to the article on my website. You'll find all of this there. So they have this legislation that's pending. It's actually moving forward. And as soon as it's enacted, it starts. They're intending to start it this year or next year. It's somewhat similar to Washington in the aspect that the benefits are $36,500. Now, New York, though, has a lot of provisions for the fact that care there is more expensive and they may have to increase payroll deductions. Payroll deductions may not be even between people of different income ranges. Some people may contribute more, some may contribute less. They're looking at allowing people who buy private long-term care insurance plans to opt out of these payroll contribution plans. So there's a lot of different ways that states are looking at all of this. But the amazing thing is states are actually doing something. Thank goodness, right? The concern is, what about all of the unintended consequences? What if you move out of the state? What if this happens? What if that happens? Because there's not a lot of experience with this yet. Unintended consequences can happen. But I can tell you who does have experience: the federal government. The federal government has a federal long-term care insurance program. It's been running for years. So the obvious question that I would ask is, have states looked at that program? Have states asked the federal government, gosh, why don't we just extend this program to states, even if we have to organize it a little differently? Because what happens if states collect all of this money and they go broke or they go over budget and there's no way to pay for the care that all of these people have paid into year after year after year through their payroll deductions? Wouldn't that be disappointing? So, should the federal government be mandated to participate in these state initiatives that are just now ramping up? Would that make sense? How can we as consumers say, hey, government, wake up. We don't mind contributing money, but we want to know that it's going to be there when we need it. So, if you want to get involved in these initiatives, many of your states are probably already looking at this. Go look at what's going on in California, in Washington, in New York. Start asking people in your state if anybody's working on this. Get involved, attend the sessions online. If you can't attend live, watch them afterwards. Because the issue is that not only in the area of long-term care, which affects older adults, but nationwide, you hear it on the news every night. Healthcare is unaffordable. People can't afford it. Even people who have insurance can't afford the insurance and can't afford the copays, right? Healthcare spending in the United States has doubled in 20 years. And there's an article, again, below linked on my website that talks about this. It's increased as a percentage of the U.S. economy and as a percentage of the national debt. We spend more on healthcare in the United States than any other country in the world. And our outcomes, our results are not as good. There's a point where we have to start asking ourselves why, and we have to start holding ourselves accountable for why. And the only way that we can do that is to look at, what aren't we looking at? What haven't we tried to fix these problems? Because we're really good at chasing the problem after it happens. So the healthcare system is really good at treating sick people, people who need care. Healthcare system has no idea what to do with people who aren't sick yet. There's not a lot of education about, how do I prevent getting sick? How do I not get high blood pressure? How do I not get diabetes? What can I be doing? Children come out of school, elementary school, secondary school, college, without knowing about health prevention and financial planning for the costs of care when we're older. Why? Because nobody wants to talk about this. It is not a great subject. It's a hard subject to talk about within families, but if we don't talk about it, we can't solve it. Just like if we don't talk about how to start eliminating duplicate government programs and duplicate spending and combine all of this for the public good, we are never going to get there. Folks, we can't do it without you. We can't do it without every one of us getting involved. So I ask you, please comment, please share the information below. Let me know your thoughts. Let me know how you'd like to change the system. And please share this video with other people that you know who are looking for hope, help, and support, people who may be unaware of all of these programs that are going on out there that may be coming to a state near you. I'm Pamela D. Wilson. Thank you so much for being here. I will see you all again soon in another video.